Come in.
Hi, my name is Greg Billings. I'm a
Hi.
PA student, Miss Billings. Just to let you know, I'm going to ask you a few questions today. Some of these questions may seem a little personal, but just to help me get a better understanding of you and as a patient and how we can better treat you, okay?
Okay.
So is it all right if I ask you some questions?
Yes.
All right. So start off, just what brings you in today?
I've just had this lingering cough for about a week and a half or so, and just wanted to get it checked up.
Okay. So you've had this cough. Have you noticed anything else about this cough?
It gets a little wheezy at nighttime, but not so much that it, you know, prevents me from breathing or anything like that.
Okay. Would you say that it's been getting progressively worse? Has it been getting better at all?
I'd say it's kind of plateaued right now.
So it's at the peak.
Yeah.
Okay. And how would you describe, is it producing any mucus or anything like that?
Yeah, a bit. I wouldn't say, no, I wouldn't say it a lot, but it does produce a little here and there.
Okay. How would you describe it? Is it a specific color?
It's thicker than just clear. It's thicker. It has a little coloration to it, but no blood or nothing serious. I don't think.
Okay.
Yeah.
Have you ever had a cough like this before?
Sure. A common cold or yeah.
Okay. And is there anything that you've tried that has made it better?
I wouldn't say better.
Nothing? No medications you've tried?
Well, I've tried a couple of allergy medicines, cetirizine, what's the other one? Allegra. But I haven't seen it really, cure me throughout the day or anything.
So do you think it's associated to allergies?
I think it is. It's the weather change. I recently moved from Arizona, so different pollens and different dust in the air. I assume it's allergies.
Okay. Is there also anyone at home that might be sick or anyone around you that might be sick?
My daughter.
Okay.
She's having the same, she's more stuffy. She's more, coughing.
So maybe it's a little bit of both, you thinking, or is it more allergies?
I think I was allergies because I did have the watery eyes and I still have the plugged up ears. I haven't had any fever or body aches or anything like that. So I don't know. I know it's not the flu or anything, but is it the common cold or is it allergies? It's always hard to tell.
Okay. Have you had any difficulty breathing associated with that?
Just the cough. Not really difficulty, but at night it gets a little wheezy. Maybe I can hear myself better at night because it's quiet. But I wouldn't say difficulty sleep. I don't wake up.
Okay. So you'd say that it gets worse at night?
A smidge.
Is there any other time that you notice that it gets worse?
No.
Okay. All right. And what about, is there anything else associated other than you said mucus, anything else that you've noticed that's bothering you today?
Other than my plugged up ears and a little bit of sinus congestion, but other than that, nothing major.
So the main things that I'm getting from this is that you have a little bit of sinus congestion, plugged ears, some of that, but your main concern is the cough.
The coughing.
You do have a little bit of mucus that you're coughing up. About how much mucus would you say it is? If you had to say in a day. Like a cup, in a cup, like a tablespoon a day.
A few tablespoons.
Okay.
Yeah, nothing.
But that's the main issue is just the cough, with a little bit of mucus. Okay. So now that I have an understanding of what brings you here today, I do have a couple questions about your past medical history, which will give me a better picture of you and your general health in the past.
Okay.
So let's start off with, you do have seasonal allergies. Do you have any other allergies to medications or foods or?
No.
No other allergies? Okay. What about, are you currently taking any medications?
No, other than a couple of allergy medicines that I try to see if it'll help me, but no.
Okay. Do you know what medications did you say?
Allegra and cetirizine.
Some Allegra and cetirizine. Okay. And what about, have you had any previous hospitalizations?
Just my C-section and getting my gallbladder out.
So you had a single C-section?
3.
You had 3 C-sections and a gallbladder? Do you know about when that was?
The gallbladder was a month after my firstborn. That was tough.
Oh, wow.
Yeah.
I can imagine.
So, do you want years or what?
Sure. If you know the years.
2011, so C-section and gallbladder. Then 2013 C-section and 2015 C-section.
Okay.
Yeah.
All 2 years apart. I like that.
Yeah.
And what about any illnesses that you've been diagnosed with?
Other than the common cold and allergies,
okay.
I don't get sick very often.
That's good.
It is, knock on wood.
Yeah. What about any illnesses you were diagnosed with as a child?
No, nothing major, more than just ear infections or colds. Yeah.
Okay. Have you had any recent travel, maybe?
We just moved here from Arizona in the summer.
Well, and have you traveled at all before that? Any major travel outside of the country?
How far back are we looking?
Just broad strokes.
Like my life?
Any major travel outside of the country?
Japan.
To Japan? When was that?
When I was 18.
Okay.
And then previous to that, I lived in Japan as a little child.
Oh, wow. Okay.
Yeah.
That's pretty fun. You're able to move back to the United States.
Yeah, I miss it
Japanese.
though. I mean, I was a little kid,
sure.
but I miss it.
Okay. And do you know of any maybe major traumas or accidents that you've been in? Any broken bones?
No broken bones. No.
No, nothing that you can remember?
Yeah.
Okay. And I do have a couple questions about your personal reproductive history. You did mention that you had 3 children via C-section. Did you have any complications with that?
No. Well, the first one was an emergency C-section because I had no fluid in me at my 38-week ultrasound appointment. So that was that, and then my other 2 were scheduled C-sections.
And are you currently still sexually active?
Yes.
Okay.
Yeah.
And do you have, or what are you doing? Are you looking to have more children since you've had the 3?
Not at the moment, no.
Okay.
No.
So what are you doing currently to prevent pregnancy?
I do have an IUD.
Okay. So the IUD is the only current medication that you're using for anything. Okay. Perfectly good. Now that I have a good idea of your personal medical history, I do want to ask some questions about your family. Now, when I say your family, I mean your parents, siblings, and your children, and also your grandparents. So grandparents, parents, siblings, children. So is there anyone in your family that has any illnesses, ongoing illnesses?
My father has reoccurring blood clots in his legs. Deep vein
thrombosis?
Yes, that's what it's called.
Okay.
But other than that, no, my family's pretty healthy. I mean, my siblings, we don't have any ongoing illnesses or anything.
And your children?
Yeah, my kids are pretty healthy other than, getting tubes and tonsils out. I mean, it's nothing out of the ordinary.
Okay.
Yeah.
And are both your parents and all of your grandparents still alive?
No, I only have one living grandfather, and that's my only grandparent alive. So.
Do you know what your other grandparents passed away from?
My mother's father, I believe he passed away. I wouldn't know. And both my grandmothers died of cancer.
Do you know at what age they passed away?
late 70s and then early 80s.
Sorry to hear that.
Yeah, it was within the last 7 years, and
Okay.
yeah.
So it's
still a little recent.
Yeah.
But we're
sorry to hear that.
Yeah, thanks.
But well, I mean, that's definitely something to be cognizant of in your own personal history and everything. Do you generally get your yearly checkups for cancer?
I do. I did get even a mammogram just to as a precautionary, because I'm not 35 yet, but I still had it done.
Okay.
I think that's when they start doing this, 35. But
okay.
But they wanted to make sure.
And do you know how to check for lumps?
Yeah, I have talked to my gynecologist about that, and yeah.
Okay.
Yeah.
So you do have yearly visits to your doctor to check pre-screen for any of that and other health issues as well?
I do.
Good to hear. Also, let's see, do you know of any history of mental illnesses in your family?
Not that I know of.
Or any history of drug use in your family?
No.
Whether medication abuse or other drugs?
I don't think so.
Okay. What about alcohol use in your family?
I mean, the only person I never knew was my grandfather, but I don't think he was an alcoholic or anything.
But do you know of anyone in your family?
Currently, no.
Okay. What about? Okay. I think that's the main things I want to know about your family. Now, I do want to move into a couple questions about your personal life. This is going to be your social life and whatnot. So some of these questions may be somewhat personal. If you don't feel comfortable answering them, that's okay. You can let me know that you don't want to.
Okay.
But is it okay if I ask you some of these questions?
Sure, go ahead.
All right. So let's start off with you said that you're currently sexually active. What kind of things do you do to prevent sexually transmitted infections?
I mean, I have an IUD put in, and my husband, I'm super, we don't want babies right now. But I mean, he wears a condom.
So no concerns about sexually transmitted infections?
No.
Okay, it's good to know. Also, do you have any personal history of drug use?
No.
Whether medications or over-the-counter or anything like that?
No.
Okay. What about alcohol?
Never tried it.
Never tried it?
No.
Good for you. That's definitely great. What about let's talk about your home life. Where do you currently live?
In an apartment.
In an apartment with your husband and your children?
Husband and 3 kids, yep.
Okay. And do you feel like you have a support system that you can go to if you need help with anything? I do. It's one of the difficult things moving away from family, but we have a local church that I have a group of ladies that we, get together often. That's good. Yeah. It's good. Yeah. Good to have something like that. And do you currently work? I do not. I am a stay-at-home mother with a 3-year-old son. Wow. Okay. Yeah. Well, congratulations. Hope you enjoy that. And then if you could briefly walk me through a day in the life as far as what you eat and anything along those lines. Usually starts off with cereal in the morning with all my kids. Then a light snack here or there, maybe a string cheese or a yogurt or a cottage cheese, some crackers. And then lunch, usually leftovers, or if I feel up to it, I'll actually make myself a salad. And then after school snacks when my kids get home. Usually something light again. An apple or some crackers and peanut butter or something. And then dinner, usually I try to make it hearty with potatoes and veggies and meat. That's usually. Okay. Do you feel like your diet's fairly healthy? Oh, there's room to improve, sure. But at least I don't sit and eat ice cream all day long. Okay.
I gotta give myself that.
So you say there's room for improvement. Is there anything that you feel that you need help with?
How do I get to like water more? Because I do need to drink water more throughout the day.
Okay.
But I just gotta.
So your main concern is the water.
Yeah.
Okay.
Yeah.
We can talk about some techniques, some things that you can do to increase your water intake. Yeah. What about exercise? How much exercise do you get in a week?
4 times a week. When my husband gets home from work, and then I go with a buddy of mine, and we go exercise at the gym. So.
Okay. So about how many minutes per week would you say that is?
When you take those classes, it's at about an hour.
So at least 4 hours a week.
Yeah.
Okay.
At least,
That's good. That's pretty good.
Yeah.
Definitely great for you. So that gives me a pretty good idea of your personal life and all of that. So now I'm going to ask you a series of yes or no questions.
Okay.
Now these questions just need to say yes or no, then we can move on and get that taken care of. So let's start off with so generally, have you had any night sweats?
No.
Or perhaps any chills?
No chills.
Okay. What about any tingling in your fingertips?
No.
Or perhaps any mental changes, maybe mood changes?
No.
Or perhaps have you been depressed at all?
I don't think so.
And I didn't say this, but this would be things in the last 4 to 6 weeks. So have you felt depressed?
Then no.
Okay. What about, have you had any headaches? You did say some sinus pain, but any other headaches?
Other than from like exercising, maybe not drinking enough water.
Okay.
But no migraines or anything.
No migraines?
Yeah.
Okay. What about a sore throat?
No.
Okay. Have you had any recent weight loss or weight gain?
No.
Okay.
Nothing drastic.
What about any maybe intolerance to hot or cold? Like you can't stand touching hot things or cold things?
No.
Okay. What about have you had any difficulty breathing? You mentioned you have the cough and everything, but
yeah, but it hasn't really made it difficult for me to breathe.
Okay. What about any heart palpitations?
No.
Or have you felt like your heart rate is going up?
Other than during exercise, no.
Okay. What about have you noticed any bruising? Like abnormal bruising, you're bruising more frequently?
I don't think so.
Or perhaps, have you ever had an urge to eat dirt or ice?
Nope, no pica.
No pica? Okay.
No, thank you.
What about as far as any joint pain?
Maybe from exercise.
Associated with exercise. Okay. Yeah. Or any stiffness in your joints?
I don't think so.
Okay. What about any diarrhea?
No.
Nausea?
No, no vomiting.
Vomiting? Yeah. Okay. What about urgency to go pee?
No.
Or maybe frequency, you have to get up during the night?
Nope.
Okay. Or have you had any issues with your monthly flow? Have you had any heavy flow issues?
No, the IUDs I'm still in that pre-6 month of getting my body used to the IUD. So it's been pretty regular still.
Or any maybe pelvic pain that you noticed?
No, I don't think so.
Okay. What about any rashes?
Nope, no rashes.
Or any other changes in your skin?
Not that I can think of.
Okay. Well, I think all of this gives me a pretty decent idea of you in a nutshell, so we can get started.
Okay.
The main things that I'm noticing was you have the cancer in your family, that's something that concerns you, and you're also not drinking enough water.
Right.
But other than that, I think that we can definitely get you taken care of.
Okay, thank you.
Thank you.